different than any other section. Okay? Basically, the suctioning part is all same, but the catheter and the ventilation and all that's a little different. Okay? So, if you're about to suction a trach patient, and how do you hyperoxygenate the patient? How to breathe?
Do they have spontaneous respirations at all?
Okay, just want to clear up with them first. He said non-breather. I mean, how can you put a non-breather?
Put the ventilator on 100%.
Yeah, I mean, if the patient is on the ventilator, you can push the 100% button on the ventilator. Have you ever seen any of you seen that yet? I know all the students with me. So.
Well, I might answer this wrong because if it was my daughter and if she wasn't on the ventilator, there's like a little ring piece that goes over her little nose that you can take oxygen to, and I would give her it through that.
When you say nose.
You don't, you know.
I know, but they don't understand.
A little HME.
Oh, the artificial?
Yeah.
Okay.
You know what I mean? But,
Nose,
so you don't talk the green too, but you know what I'm talking about.
Right. When she talked about artificial nose, that goes on the trach. Okay. All right. So if they are not on the ventilator, you could either ambu the patient with the 100%, take the patient off, whatever, and bag the patient.
That's why I get mad and she cried and she let it go away. Get that off of me.
Okay. Hyperoxygenate that way. Or,
How many?
about a minute or so, 1 to 2 minutes. And if the patient is not on ventilator, then if they're on trach collar, how do you hyperoxygenate?
You can just do it.
Well, a couple things you can do. You can hyperoxygenate by taking the patient's FiO2 from whatever, like if they're on 40, take it up to 100%. That doesn't mean that you're going to hyperventilate. You're going to hyperoxygenate them, but you're not going to ventilate them. So if you see a patient that's shallow breathing, and if you really want to hyperoxygenate and hyperventilate them, you really have to take them off and bag the patient. But if they're already breathing nice and smooth and normal, then you can just turn up the FiO2 on the bottom to hyperoxygenate them. Y'all getting what I'm saying? So not all the patients are good enough. You can just go over there and turn the FiO2 up to 100% and start suctioning the patient. It's not a good idea. But look at the patient. If they're on, if their pulse ox is normal, reading, normal levels, and they're breathing like normal. And if you want to hyperoxygenate them, just go ahead and turn the dial on the aerosol bottle up to 100%.
So even if they're reading like 98, 99% from pulse ox, you can still bump them, give them a little bit more.
If they are not breathing deep, if they're not taking nice deep breaths, yeah, you take them off and back.
If they're on room air, when you come into the room and you're going to suction them.
Absolutely. You have to hyperoxygenate.
Okay.
His question is interesting. He's saying 98, 99 sat level. He's still, and I would think, yes, if you want to put too much oxygen
Yes.
into the blood.
You need to give them more oxygen.
Okay.
And
You're going to take away below the 98.
right. The question is not only hyperoxygenate them, do you want to hyperventilate them? Okay. Yeah. I mean, you do want to hyperoxygenate and hyperventilate the patient. Well, you cannot hyperventilate with somebody with a trach collar. What you can do is you can ask them to take deep breaths while you're turning the dial up to 98%. And if they can do that, yeah, you don't need a bag. You turn the dial up to 98% on the bottle. Okay? But if they can't take a deep breath, you have to take them off the trach collar and bag them with the 100%.
If they take a deep breath and you're going in there to suction, and they probably got a bunch of crap in there, and they do some cough and a big loogie might come flying out.
So either way, if they can't take a deep breath, then you do that.
Yes.
Okay.
That's what we do. We don't actually go in there and bag everybody when they suction. If they're on trach collar. We ask them, can you take deep breath? They'll say, okay. Then we just turn that FiO2 up to 98% and ask them to take deep breath for about a minute or so. Then go suction.
If they're on a ventilator, then
Yeah, if they're on the
you
ventilator,
just turn the oxygen
yeah, you push the 100% button on the
Right.
ventilator.
and then suction.
Then use the inline suction to suction.
Okay.
But if you're taking them off the ventilator to suction them, bag them.
Bag them.
If you're taking somebody off the ventilator, that's definite. What happens if they're on the ventilator and you push the 100% button and you're taking them off?
You're not getting 100%.
Yeah,
Yeah.
they're not ventilated. They need to be ventilated. Okay, so.
So that would be if you did, they would most likely not have inline suctioning,
Correct.
probably.
The first one I'm going to show you is, just imagine this patient does not have an inline suction catheter. This patient is on a ventilator at this point with trach. No inline suction catheter in place, okay, for some reason. The doctor didn't want an inline. So, but they want you to suction the patient. My first question is, how do you hyperoxygenate this patient?
And you said they're, say, I didn't give a scenario. we
So
don't
this
write it
patient-
up. Say it again.
This patient does not have an inline suction catheter,
Okay,
but he is on a ventilator.
okay.
And you want to take him off the ventilator and suction him with a regular suction catheter.
Okay, you're gonna take
How do
him
you
off
hyperoxygenate?
and you're gonna use the ambu bag.
Correct. You're going to take him off.
As soon as you take them off the vent, you're gonna lift it. Percent you put.
That's right.
Yes.
That's right. So therefore, pushing 100% on the ventilator is not going to do anything because you're going to take them off to suction patient. Okay, that's what I'm going to do right now. We do this sometimes. If they have thick mucus, for some reason the ballot does not work, the ballot doesn't work with every patient. Sometimes if they have thick secretions, we would prefer them to come off and we will ambu them and suction with the regular catheters, okay, to break that stuff. Okay, that's what I'm going to do first. Okay, so you silence the ventilator, you're taking him off the ventilator and ambu. Before that, you have to get this thing ready. This step is pretty same that we showed you last week. How do you put the gloves on? This is not going to go on my hand. This is okay. You don't want to touch outside. It's very small.
Pretend that one of these
Well, I got it. So I got this one on and it's sterile. And I can touch this glove anywhere I want now. But I have to slip my hands inside. You see this? Slide it up. Slide it up. Okay. All right. Now, take this. On it. Now, this is where the important question comes in. What size of suction catheter should I use for that trach patient?
Oh, we went over this last night. Okay, you take the size of the tray and you
The
divide.
size of the trach is, let's pretend this is 4. Okay.
And
This
you,
this trach is number 8.
so we said last night, we divide it, divide it by
No, what?
2, take half the size.
Before we say anything, I want you to look into the lab.
The lab book, I don't have it with me, it's at my desk.
Catheter numbers go
She
higher.
has it. Brian, you
Alright,
have
look
it.
it up.
It's there. I looked at it this morning before we
Catheter
came.
numbers go higher as it gets smaller.
14. Would it be 14?
Divide by two, multiply.
No, I don't wanna take that. I wanna go by the lab book here. That's the whole stuff we put it in there.
Determine the size of the suction catheter to use. The outer diameter of the suction catheter should not exceed 1/2 the size of the inner diameter of the airway, because the airway is usually measured in millimeters, and suction catheters are usually measured in even number French size. A conversion is necessary. The following is the formula which will result, blah, blah, blah. Okay, so it's 0.5 inner diameter millimeter times 3 plus 2
There we
equals
go.
French suction catheter size.
Okay, now, what we're gonna do is half of the trach size. The trach size is what? 8. Half is, and times 3 plus 2. 14 French catheters. Okay? Any question about that? Half times 3 plus 2.
That's what I had on last.
This is what I was trying to tell you guys yesterday.
Okay, so that is
Okay.
a 4, you said, you're presenting that's a 4?
No, this is actually 4, but I'm pretending this is 8.
That's, I mean, do they think they're there? I guess they do.
Oh
Eight's
yeah, all of our
normal for
patients
adult.
are 8s.
Almost 8 for
Yeah.
adult.
I'm talking about, oh, you're talking about the catheter size, I'm talking about the trach size.
Yeah, it's all 8. 8 is the norm.
Oh, see, I'm used to kids.
So it's divided by 2, times 3, plus 2.
Yeah. So if my trach size is number 6, what's my suction catheter size?
9 plus 2.
11.
11. We don't have an 11.
So it's a 10
10 or
or
12.
12.
Smaller rather than larger.
Well, how do you know? Well, now that's good question. Which one are you going to use, a 10 or 12?
I want to make sure it's going to fit somebody as well.
Well,
Or a larger one's going to suck more.
yeah, the larger one will suck more. The problem is it's going to block the airway.
Yeah.
Okay.
So is a 10 better? If you have an 11?
10 is actually better. When you start suctioning, if you're not getting a lot of secretions, with 10, what do you need to do then?
Then you go to the
The
12.
12. If you have thick secretions and if you can't get the stuff out with the 10, you want to go to the next step, which is 12. This stuff is on the exam, on your NBRT exam. So make sure you understand this, okay? Okay, so if your trach size is number 4, what's suction catheter size?
2 times 3 plus 2.
8.
8. And you can go one step higher, one step below.
If this is an 8, so what do you guys say that should be? So that should be 12 plus 2 is
14. 14.
Okay.
So you can actually use 12 or 14. I've never seen a suction catheter of 16. I think the 14 is the largest that I saw. Okay? So you can actually go down 12 or 14 before the number 8. Right?
That's pediatrics, a whole different world.
Yeah.
You're small.
So this is the main difference with the suctioning the trach. This is extremely important. You have to pay attention to it because when you come to the hospital, if you, you know how many thousand times I go in a patient room, they have a number 4 trach in, and they have a 14 French suction catheter sitting there, and nurses are suctioning them with the 14 French suction catheter. And the patient is bleeding.
Probably hypoxic.
Yeah, they're sticking a huge suction catheter down to their airway, and they can't even breathe, and it's hurting them. So, that's extremely important. Okay. This suction catheter obviously not going to go through here. What suction catheter is this? Does it say?
I can see it, 14.
Anybody see this? 14 French suction catheter. Can I suction with the 14 French for this particular trach?
You said it was a
This is
size
a 4.
4? No.
It's not going to go in, but I'm just going to pretend. All right, now, I got the right size of suction catheter. Well, I got the lube here already. it up.